Let's talk fundamentals. If you just started anatomy, there are a lot of new concepts which lay the groundwork for the rest of your medical career. In this video, we're going to explain and reinforce these concepts. Let's start by defining anatomy and physiology, and I can almost guarantee that you'll have one question on your first test covering this. Anatomy is the study of structure. I like to say when we are talking about anatomy, we are talking about what something is. Physiology is the study of function. When we talk about physiology, we are talking about what something does. If we look at my trachea, it is made of cartilage. My prominence is located inferior to my mandible and superior to my clavicle. Anatomy. We talked about what it is and where it is. My trachea is my windpipe. It allows air to reach my lungs. Now it's made of cartilage, so it does not collapse when there's low pressure. This is physiology. We talked about what it does. Now, of course, these fields are related to each other because form is directly related to function. Let's talk directions. Have you ever received directions using landmarks you've never heard of or calling streets by the wrong name? It's kind of frustrating, especially if you're the surgeon reading a chart. He's got a spot on his arm, kind of near the elbow. So let's learn our directions. The words for front and back are anterior and posterior. And for humans, there's actually another set of words that are interchangeable. Ventral, meaning front, and dorsal, meaning back. This is actually a little bit different for Jedi here. Ventral actually refers to the belly side, and dorsal to the spinal side. So his directionality from nose to tail is anterior to posterior, and from belly to spine, ventral to dorsal. Good point. For us humans, we point our bellies forward and our spines backwards, so the terms are interchangeable. The rest of these words describe a relationship between two objects. There's superior versus inferior, there's medial versus lateral, deep versus superficial, and proximal versus distal. Superior versus inferior describes a vertical relationship between two objects. Looking again at my tracheal prominence, it is inferior or lower than my mandible. Or we can flip the sentence and say that my mandible is superior or higher than my Adam's apple. Medial versus lateral describes a horizontal relationship between two objects. The medial object is closer to the midline of my body. The lateral object is closer to the edges. My pectoral muscle group is medial compared to my deltoid muscle. And if you reverse the order, my deltoid muscle is lateral compared to the pectoral muscle group. Deep versus superficial compares objects based on how close to the center versus exterior they are located. My skin here is superficial or closer to the outside than the muscle underneath. And the muscle is deep or closer to the center than my skin is. Proximal versus distal is only used to describe locations on a limb, so arms or legs. The proximal object is closer to the point of attachment. The distal object is closer to the tip of the extremity. My elbow is proximal compared to my wrist because it's closer to the point of attachment, which is my shoulder. In contrast, my wrist is distal compared to my elbow because it's closer to my extremities. In a medical setting, these terms can be used in a combination of ways to describe the locations of abnormalities. For instance, charting an injury could be described as a superficial abrasion on the right upper extremity, distal to the antecubital region. Of course, the antecubital region is one of many regions to memorize, but today I would just like to focus on the abdominal regions. If we look at the quadrant system, the names are straightforward. Left upper, right upper, left lower, right lower. Just remember, if your patient is facing towards you, their left is on your right.
Jedi, right paw.
No, your other right paw.
Good boy.
See, he's got it. Now let's look at the other system of abdominal regions. Though it may feel a bit arbitrary, each of these regions is named for a landmark. At the top of the two outsides are your hypochondriac regions. Hypo meaning below, and con meaning cartilage. This region refers to an area below cartilage, specifically to the region below your rib cartilage. The middle outside regions reference your spine. This section of your spine is the lumbar section. You can remember this if you've ever bought a little cushion that said lumbar support, because they fit right in that lower section of your spine. The lower outside regions start at and reference your hips. This ridge is called the iliac crest. So these regions are your right and left iliac regions. The upper and lower center regions are named for your gastrointestinal tract. There's the epigastric region, epi meaning upper, so above your gastrointestinal tract, and the hypogastric region, hypo meaning lower, so the region below your gastrointestinal tract. The very center region is our umbilical region, named simply for where our umbilical cord once attached. And that about wraps us up. If you stuck with us to the end, then on your next trip to the doctor's office, you can give your nurse proper directions. Thank you so much for watching. Until next time, take care.